top challenges you see in the life science and healthcare field for DHL forwarding and the industry in general?
I think one of the major challenges we have today is this trend for our customers to move their production and sourcing sites around the world. Traditional markets, Europe and the U.S. Are flatlining, so customers are looking to grow their businesses in Africa, in the Middle East, in Asia, and where there hasn't been the kind of infrastructure that's required to move our customers' product. So as they're moving their resources there, and they want to manufacture or buy active ingredients or trade with other partners out of those regions, the industry requires temperature controlled capabilities. It requires very specific processes to handling those products, and it requires people who understand how to handle them in the proper way. So as a logistics provider, we need to ensure that we have all those components in place to enable the growth of our customers, and I think that's part of our challenge.
Well, what are some of the ways you've addressed that?
We've addressed it in a lot of different ways. One, we've had a very active program of anticipating where the markets are going to be. So we've built life science competence centers in India, in China, in Australia, in Dubai. So we're putting facilities where our customers need us to be. And behind those facilities, we're putting the assets, the people assets, and which makes everything run. And we're training those people through audit training programs, e-learning capabilities, and this way they know how to handle the products and implement the kind of processes that are needed. So when you take infrastructure, people, and process together, and you put it into that emerging market, you've enabled the customers' capabilities to trade with those markets.
How do differences in customs clearance affect the supply chain for this type of product?
Sure. Customs clearance in every country could be very different. There's a lot of different processes and regulations. And of course, we have a lot of different products moving around the world. And for the mature markets, a lot of our products are non-dutiable products and get through customs fairly easily if you pre-plan. So what it does for us as a logistics provider is it requires we sit down with our customers and understand the very uniqueness of those products. We understand the classifications and the HTS numbers, and that we have standard operating procedures defined for handling those products, and we train our own customs department. So there's a lot of pre-screening that's done, a lot of work that's done in advance to make sure those products get into the countries they need to in a very efficient way.
What makes this type of product different that can be affected by problems? And
sure.
clearance?
Well, the life science and healthcare products are wide-ranging. Right? It could be an instrument. It could be a catheter. It could be a cancer vaccine, right? What's different about them is that in the end, they're all improving people's lives or maybe saving someone's lives. So, it's critical you get the product delivered to the right place, at the right time, and in the right condition. And so that's very different from moving an auto part or a notebook computer around the world. You might get delayed in customs, but if you get delayed with a hemophiliac medicine, a child can die. So you have to be very careful how you handle these products, and you do the right planning to move them around the world. You have perishability with these products. So if you're doing large bulk moves between manufacturing site and a reprocessing center, a lot of the pharmaceuticals are created in batches, and that batch production could be a 6-month cycle. So if you miss a batch that's going to South Africa, for example, from the U.S. or Europe, a customer may not get that batch, or a distributor may not get that batch for another 6 months. So you have perishability, you have high valued goods, you have the potential for theft and pilferage. So there's a lot of requirements that we wrap around, moving these goods around the world.
So you need training and equipment to do this right.
Well, you need certain types of equipment for the temperature-controlled products, yes, and you need training whether they're temperature-controlled or not. You need a high degree of competency, whether you're at the origin or the destination, for moving these products.
What kind of training does DHL Forwarding do to develop this kind of skill?
Sure. Within the global forwarding environment, we have dedicated people, and those people are put through a training program that is what we call our life science training program, but it's designed behind a good distribution practice quality standard. And we use that as our quality standard to create the training program, and then we roll that out through the different sites in the world that are handling these kind of products. We use e-learning as a tool. We have many programs that is life science specific e-learning amongst not just general transportation requirement training, but specific to life sciences. We have regular gatherings, physical training programs, and we do what we call our community calls. So every month we have a global call through WebEx where we do best practice and case study training.